Until the start of school, Adam and I sat down with SSM Health Dr. Mandira Mehra about some of the things families should keep in mind.
High blood pressure is an issue that adult senior citizens always have to be mindful of.
But there is a new warning about high blood pressure and hypertension for young people. Here to talk to us a little bit more about this is our medical expert, Dr. Mandira Mehra from SSM Health. Good morning. Thank you for joining us.
Yeah.
I mean, this is a scary kind of thing to conceptualize, that something that has usually been reserved for older folks, something we have to worry about later on in life, is now very relevant for younger people.
Exactly, and we've talked about this before. Unfortunately, so much of our children and adolescent population is falling into that category of overweight, obese. More and more diabetes is on the rise as well. And so previously, there were only recommendations for high blood pressure or hypertension in that pediatric population if children had conditions like obesity, diabetes, and such. The new guidelines actually point out recommendations even just for normal children. And so it's a great reminder for pediatricians, for parents, to really be cognizant that this is something we can intervene on earlier in life that might help them make decisions down the road that can help them from getting things like hypertension, diabetes, cardiovascular disease, stroke, heart attacks, things like that.
And some of these guidelines, I mean, we should be asking doctors to check blood pressure now for their kids when they're going into checkups.
Yeah, and yearly, basically. So the guidelines do help us see that it's not just sort of, okay, we'll check it every couple of years. It's let's check it every year. And if pediatricians do notice that the blood pressure is high, there's different things we can do: lifestyle modifications, diet, exercise, and ultimately, of course, medication. But the studies do show the sooner we can intervene, the better children will be into adulthood.
So a lot of doctors giving back-to-school physicals right now. It's the time of year. I've made no secret on this program about one of my children being kind of anxious, always about going back to school and the concerns and the nerves. What kind of advice do you have for parents out there who are maybe seeing some of those symptoms in their kids? Yeah,
that's a great question, and we always do back-to-school tips for kids, but this is a little bit different. We're saying back-to-school tips for parents, and so we can start kind of with that, the nerves, the anxiety, the excitement that comes at this time of year. I mean, kids have been having a great time at home, summer break, really in a comfortable, safe environment, and this is a great time for parents to say, this is a comfortable, safe environment. You still feel supported. So our first tip today is to say, support your child, cut them some slack. Number two is give your child some choices. Easy choices, like, what would you like for lunch? Do you want lunch from home? Do you want lunch from a cafeteria? What would you like to wear? The more ownership a child has over their decisions, the more involved they're going to be in school and more excited they're going to be. Some other things that you can do is also encourage them to be well rested. So the average elementary school child should get 10 to 11 hours of sleep. Of course, with technology, Nintendo, Game Boys, I'm dating myself, but iPhones, a lot of children aren't getting that. So trying to cut back on some of that technology and telling them to sleep earlier and earlier will help them sort of get the proper rest that they need. And the last tip is form a connection with your child. So oftentimes as a parent, you say, don't do this, or do that. But just
You're looking at me when you're saying that, by the way.
But telling them stories about your own childhood and saying, you know, my parents told me this and I did that. So making that connection kind of makes it easier. The studies do show that this is a really critical time. So the more we can tell our children now, let's set these healthy examples, that'll help them for the whole academic year.
Also helps to kind of just get the feel of understanding, you know, if we start a new job or that kind of, I mean, like the nerves, it's real and it's fair.
It is very real.
It's fair to have those feelings. There's nothing wrong with that.
Yeah.
Dr. Mehra, it's good to see you.
Great to see you.
Thank you so much.